how does diabetes affect your feet? Like, why do diabetics get diabetic foot ulcers, and why is there an amputation rate? Well, let's start with the basics. Diabetes affects wound healing, immune cells, and connective tissue. Skin is a form of connective tissue, so you'll get calluses from pressure points, right? From abnormal forces in the foot and bone. Think of it this way. If you get a muscle contracture in your foot because you've got a tight, thick muscle that's not moving right, that's lost its flexibility, which diabetes does, then you'll get a pressure point in your foot and the skin responds by forming a callus. You know how guitar players all have calluses on the tips of their finger from constantly fretting? That's a similar thing. You've got an overload point on the bottom of the foot from some bony prominence and you form a callus. Fungal issues or infections, particularly toenails, will become just taken over by fungus. Blisters, which make no sense, like you wear anything and you get a blister. Swelling for no apparent reason, and that's because diabetic tissues fill with fluid. There's not good fluid management because the cellular processes aren't working right. Poor healing abilities, we already talked about that. So like you step on a rock, you don't really notice it, and then that turns into a big sore that never heals. Whereas normally, like when you were a kid, it would heal in a day. And then you Charcot neuroarthropathy, which is one of my specialties, and that's when diabetes is so extreme that the foot just becomes completely deformed and you just get huge ulcers that nobody seems to be able to handle. These are the people that are at risk of amputation, and my primary concern is limb salvage, so we do everything we can to prevent an amputation. But this is where it all starts. In 2012, think about this, and this is 8 years ago, right? Louisiana spent $4 billion on the care of diabetes, and a lot of that, believe it or not, is foot care. So why do the feet go bad? Well, one of the primary reasons is diabetic sensory motor polyneuropathy. So instead of me saying that all the time, I'm going to say DSPN, or I'll just say neuropathy. So diabetic foot ulcers and then diabetic amputations usually are a direct result of diabetic sensory motor polyneuropathy, okay? 33%, a third of diabetics have neuropathy. 25% will have a painful neuropathy, but 50% have no complaints. And then the other 25% just have vague, weird complaints that aren't really pain, but they aren't symptom-free. But it's scary to know that about half of the people with neuropathy have no idea they have it. And it's actually more common in the group with pre-diabetes, that 86 million of people that we talked about, than it is in diabetes. Polyneuropathy is a length-dependent disorder of the nerves. What does that mean? It's going to affect the nerves that are the furthest away from the brain and the spine. That's why it affects the toes first and the fingers next, right? So people will feel what we call a stocking glove distribution of burning pain or numbness. It'll feel like they pulled their socks on. It starts in the toe, goes to the ball of the foot, goes to the midfoot, then the heel, then up the leg. Same in the hand, just the same as you're putting a glove on. Tips of the fingers, middle fingers, palm, then up the arm. So the longer the nerve, and obviously the longest ones go out to the ends of the limbs, particularly the toes, those are going to be affected first. And it's from the impaired metabolism. We talked about metabolism already. And impaired microcirculation. So a lot of diabetics have peripheral arterial disease that goes with the diabetes. And this affects not just the big vessels like the aorta and where people get stents. You probably had somebody that's had a stent either in their heart or their legs. Well, the teensy tiny vessels that are unstentable because they're too tiny, they get clogged off too. And then that means the nerve has no blood supply. So it's like a double whammy. It's a progressive and a chronic disorder. It's really not curable. We can make it a lot better, but there's really no cure as of yet for neuropathy, and it is very underrecognized, very undertreated. We're experts in this. We look for it all the time, but I'll tell you, there's a ton of people walking around with diabetic peripheral neuropathy that have no idea about it, and they're going to be the group that is at risk of amputations in a little bit of time. So one German study, for instance, showed that they looked at a group of people with painful and painless neuropathy, okay, and they had type 2 diabetes. The painful group, 57% of them were undiagnosed with diabetic neuropathy. So here's a diabetic with a painful foot and nobody diagnosed him with neuropathy. 82% of the painless group. So here's the problem. A diabetic goes to see their doctor and they just get their blood sugar checked, the A1C. Hi, how you doing? How you feeling? Okay, great. Here's your meds. See you later. Well, you have to do a diabetic foot exam, and you've got to screen for neuropathy so that you can catch this and potentially manage it and keep it from getting worse. That's what we do. We're excellent at screening for diabetic polyneuropathy, and we can even go as far as the nerve conduction studies that'll pick it up as well. And what will happen is you have abnormal pressure sense. That's why you can develop a callus and eventually an ulcer from an abnormal contact point. You don't feel vibrations the same way. You lose your sense of position. So a lot of times you have balance problems. And then you really have temperature issues. So I actually had a patient once whose diabetes was so bad, he was doing Epsom salts and ended up getting like a frostbite reaction from soaking in the water too long because he didn't feel that his skin was changing. So it can be very scary. If you even think for a second you might have this, you should probably get screened.